What is the clinical presentation? Yeah, as I told you, the most important is menstrual abnormalities and menstrual cycles leading to amenorrhea or oligomenorrhea. Some people do have primary amenorrhea. If it's a pre-pubertal girl, then first thing we have to rule out in primary amenorrhea is POI. And the menstrual symptoms, yeah, the menopausal symptoms like hot flushes, vaginal dryness, sleep disturbances, mood disturbances, all these are there, and changes in skin, vitiligo, these are the skin changes, hair, and goiter is one thing which we have to rule out, ma'am, because Hashimoto's thyroiditis may be, there are some antibodies which are going and directly attacking the oocytes. Even in those cases, the ovarian reserve is being autoimmune, all the autoimmune, like you take SLE, you take rheumatoid arthritis, you take goiter, like Hashimoto thyroid, all these autoimmune disorders, maybe there is a oocyte reduction when compared to same age people, and these people there is a decrease in the oocyte reserve. And also anxiety, depression, fatigue, of course all these are mood disturbances. And how do we examine? So most important, in family history, if we see second degree or first degree, either the mother or the sisters or the khalas, they will be having a similar family history. See, someone in the germline will be having these disturbances, yeah, most of the time, but sometimes it is idiopathic also. So documentation of the family history, maternal age of menopause, and family history of POI. क्यों जा रहा है ये पीछे अपने आप? History of autoimmune or genetic disorders. So physical examination is very important, ma'am, because sometimes क्या होता है, these uterine malformations will also have this genetic oocyte abnormalities or reduction in the oocytes. What do you call this? Urogenital defects are there, na? Usme bhi you can see POI in some cases. So how do we diagnose this? They have hypergonadotrophic hypogondism. So if you see FSH, LH, all these will be raised, whereas the AFC and AMH will be decreased in these cases. 45 and 40 and above they are saying, but we have seen cases wherein they are 30 years old and they have only two AFCs. So, matlab primary infertility will be their main cause of coming to the doctor. Yeah. So, pelvic ultrasound, transvaginal ultrasound will confirm the ovarian compromise, and thin endometrium, very thin endometrium, because the estrogen levels have been decreased. So, the oocyte, because of the oocyte decrease, the estrogen is also decreased, and same thing with the endometrium. Endometrium is also like very thin. And the radiological imaging is also not, it is not essential, but AFC with endometrium you can correlate with FSH and LH and AMH, then you will have a proper diagnosis of this. So what is the sequelae? So they have high mortality rates because cardiovascular risk is very high as the estrogen is decreasing, and reduced fertility rate is also there in them. That is how they come to you finally. Periods hondo, nahi hondo, that is a different issue, but when finally they want a baby, by 30 years of age they would come, because by 20 years anyways they would get married, 10 years of married life. So if you screen them, this would be the case. And reduced bone mineral density and increased cardiovascular risk is also there, and poor oocyte quality, yeah, and genitourinary symptoms are also there, like dryness and recurrent UTIs, all these are the symptoms. So these are the how do we manage this? So most often we have to relieve them of those menopausal symptoms, and then we can look into infertility for them. So how do we do it? So most important is, yeah, the estrogen replacement is the most important critical role, and as I told you, we give some testosterone supplementation also, because with this testosterone what happens, the libido, the whole sexual cycle, wo sab, all that is also important for this thing, right? And along with that, not only that, the oocyte antral follicular count jo hai na, that will also increase. So we give, generally how we give is testosterone, we give it like twice a day, morning and evening with 2 puffs. Most important thing is estrogen replacement, ma'am. Either it is local or oral. I'll discuss about what all we have the options. And of course cardiovascular health is very important. With estrogen supplementation, we know that it is beneficial for the heart, and then that is how we have to initiate the HT.